It's common to have concerns about what might be a problem when you're pregnant. Most pregnancies don't have any serious problems. But it's still important to know when to call your doctor, midwife, or nurse advice line if you have certain symptoms or signs of labor. These are general suggestions. Your doctor or midwife may give you some more information about when to call. Bleeding from your vagina that is heavier than spotting. Severe pain in your abdomen. Clear fluid leaking from your vagina. Fever or chills. Shortness of breath or a racing heart. Pain or swelling in one leg. It's also important to contact your doctor, midwife, or hospital immediately if you have experienced a hit or blow to your stomach, such as from a fall, car accident, or family violence incident. See your doctor or midwife as soon as possible if you have problems with your emotional health that last longer than 2 weeks, such as feeling depressed or anxious, or being unable to do your usual everyday tasks. An unusual discharge from your vagina. Weight loss. Urgency, pain, or a burning feeling when urinating. Swelling in your legs that doesn't improve overnight. In early pregnancy, contact your doctor, midwife, or hospital immediately if you have severe pain or cramping in your lower abdomen or pain in the tip of one shoulder, especially if you also have bleeding from your vagina. Dizziness or fainting. In later pregnancy, contact your doctor, midwife, or hospital immediately if you have changes to your vision, flashing lights, or blurry eyesight. Sudden, severe swelling in your hands, feet, or face. A headache that doesn't get better if you take pain-relieving medicine. Pain under your ribs. Extreme itchiness of your skin, especially your hands and feet. Go to your local hospital immediately if your baby has stopped moving, or is moving less than usual. What will happen when I see my doctor or midwife? When you see your doctor or midwife, they will ask you about your symptoms and examine you. They may perform some tests to check your and your baby's health. These tests may include measuring your blood pressure, an ultrasound, blood tests, a urine test. They may give you a referral to another doctor or health professional, or they may send you to hospital. The treatment you will be offered depends on your individual circumstances and what is causing your symptoms. You might need to be monitored more often throughout your pregnancy. Your doctor or midwife will talk to you about whether it's safest for your baby to be born early. How can we avoid pregnancy complications? 1. Attend appointments regularly. Going to all of the routine OB/GYN visits throughout the entirety of a pregnancy will allow a woman's physician to monitor and keep track of the baby's heartbeat, growth, and overall health, as well as the overall health of the mother. Similarly, attending all of the appointments of a high-risk pregnancy specialist will increase the likeliness that a medical condition or issue is detected sooner rather than later. Thanks to 3D and 4D ultrasounds, as well as non-invasive testing for complications and conditions. Taking these appointments seriously and showing up to every single one could be life-changing and life-saving for your baby. 2. Make your health a priority. Just because you have someone else to worry about now does not mean that you can stop making yourself, primarily your health, a priority. Extreme fatigue, high levels of stress, and a poor diet are all contributing factors of serious pregnancy complications. If you are pregnant, getting the recommended amount of sleep, usually 7 to 8 hours a night. Sticking to a healthy diet and exercise regimen and taking the time out of your day to reduce stress levels, whether it's a brief meditation practice or a brisk walk in the fresh air, is advised to. Keep yourself and little bundle of joy safe. 3. Quit smoking and drinking. Whatever you consume, the baby does also. So when you're drinking alcohol and smoking tobacco, those harmful substances are going directly to the baby, negatively affecting them, too. Preterm birth is a serious complication and direct side effect of smoking and drinking while pregnant. And it is strongly recommended that a woman quits as soon as she is trying to conceive and/or when she finds out that she is pregnant. Even though it can be difficult to quit. Remembering the risks that come along with a preterm birth, such as infant death and long-term disabilities in your child, will make the process easier to complete. 4. Avoid harmful foods. Food safety is a crucial element of maintaining a healthy pregnancy. In fact, not consuming harmful food that could hurt your baby is actually one of the most preventable measures a pregnant woman can take. Foods that do present a risk to a baby's health are categorized in a number of ways, especially those that contain certain bacteria, like Listeria, Salmonella, and Toxoplasmosis. Avoid unpasteurized milk and cheese, Cook meat thoroughly before you consume it, skip out on soft-boiled or raw eggs and avoid any undercooked poultry. In addition, be sure to wash and cook vegetables thoroughly as well. 5. Maintain a healthy weight. A pregnant woman's weight is a make-or-break factor when it comes to pregnancy complication prevention. Overeating, eating too many sugary foods, acquiring diabetes, and being overweight in general are all possible triggers of preeclampsia, a condition marked by high blood pressure that can directly affect the baby's ability to receive blood and oxygen while in the womb, in addition to gestational diabetes. Oppositely, being too thin and not eating enough are damaging factors as well. Avoid preeclampsia, gestational diabetes, and other complications by maintaining a healthy weight throughout your pregnancy. Women are encouraged to exercise regularly at their doctor's discretion and consume a healthy diet.